Why do kids with Tourette syndrome experience palilalia? Imagine hearing a child repeat their own words over and over again without meaning to. This can seem strange or confusing, but it is a common part of some children's experience with Tourette syndrome. Tourette syndrome is a neurological condition that causes sudden, involuntary movements and sounds called tics. These tics can be simple, like blinking or throat clearing, or more complex, such as repeating words or phrases. One of these complex vocal tics is called palilalia. Palilalia is when a person involuntarily repeats their own words or phrases multiple times. It often happens without the child realizing they are doing it. This repetition can be frustrating or embarrassing for children, especially when it interferes with talking to friends or teachers. The reason children with Tourette syndrome experience palilalia is linked to how their brains work. In Tourette syndrome, certain areas of the brain that control movement and speech do not function normally. These areas include parts called the basal ganglia and the frontal cortex. They help us control what we do and say. When these parts are not working right, it can cause involuntary behaviors like tics. Palilalia is a type of vocal tic that happens because the brain circuits involved in speech are affected. These circuits help us produce and stop speech, but in children with Tourette syndrome, they sometimes send mixed signals. This causes the child to repeat words or phrases automatically, even if they do not want to. Genetics and environmental factors also play a role in how these brain circuits develop. If a family has a history of Tourette syndrome or other neurodevelopmental conditions, a child might be more likely to experience palilalia. Stress or excitement can also make tics worse, including repetitions. From an emotional point of view, palilalia can be upsetting for children. They might feel self-conscious or anxious about their speech. It can make social interactions harder and sometimes lead to feelings of frustration. Understanding that palilalia is part of Tourette syndrome helps parents, teachers, and friends respond with kindness and patience. Supporting children with Tourette syndrome involves teaching them ways to manage their tics and emotional responses. Behavioral therapies like comprehensive behavioral intervention for tics can help children become more aware of their tics and develop strategies to reduce them. Creating a supportive environment where children feel accepted helps lower stress, which can lessen the frequency of tics. In summary, palilalia in children with Tourette syndrome happens because of differences in how their brains control speech and movement. It is a type of vocal tic caused by disrupted brain circuits. Helping children cope involves understanding their condition, offering emotional support, and using therapies that teach them to manage their tics and feelings.